Yes, sir, we can hear you.
So, how many students are in your batch?
I'm not so sure, sir.
That's good. Okay, no problem. So, we have to wait for some more time, or we can start the lecture. Hello?
I think we can start, sir.
We can start. Okay, thank you. So, good afternoon to everyone. Today we'll be discussing about the topic that is called as Introduction to Traumatology and Orthopedics. The first two lectures in our department, today's lecture and tomorrow's lecture, they are considered as fundamental lectures for the subject of traumatology and orthopedics. So I would like that you all pay good attention towards this lecture. Soon, I think this lecture link, I will be uploading it in Moodle, and in Moodle also you can revise this lecture before your classes. Okay, doctors?
Okay, sir.
Great.
Yes, sir.
Okay, great. So there is, okay. So in this lecture, we have a lot of definitions. They are fundamental definitions. I will try to make them very simple so you can understand and you can remember them. So the first definition, definition of the subject itself. Yes. So what do you mean by traumatology? So traumatology composed of two words, trauma and logy. Yeah? Trauma means injury, logy means science. Science studying about what? We study about musculoskeletal system. So what is included into the system? So it includes muscles, muscles will have tendons, then we have what skeletal system, that includes what bones, so if you take bone, bone inside with the bone, we have bone marrow, Next, surrounding the bones on the two edges, we have what articulating surfaces maybe, So articulating surfaces too, they connect, they form a joint, So capsules, maybe ligaments. So all these things are included into this thing called as what musculoskeletal system. So musculoskeletal system, this is a fundamental structure, It gives you the shape, like how you look like, you can see your skull bone, it gives you mobility, so because of your musculoskeletal system is what you can walk, you can run, maybe not jump from the mountain, you can dive and fly, So apart from that, musculoskeletal system, in the thoracic cavity, in cranial cavity, it protects vital organs. And apart from that, what happened? Other homeostasis function and so on. So what is traumatology? So it is a section of clinical medicine. So if you understand the word, so it is a clinical medicine. Studying about what pathogenesis of mechanical injuries to musculoskeletal system. So as a doctor, what you will do? You will do diagnosis, treatment, and prophylaxis. So this is a component of it already. So here there is nothing much to memorize. So I hope you understand the fundamental, traumatology. I think definition is straightforward. I believe you can remember them. So trauma, injury, logy means science that studies about what injuries, that is injuries to what musculoskeletal system, devising methods of. So here we have the emblem of traumatology and orthopedics. Which was drawn by Nicolandre in 1744. So bending tree supported by a stick. In modern books, modern English literatures, you can see the same. You can see the same thing in a format that is being described over here. So this is an emblem. Why it is so, we'll see here in this thing. So if you go across in your countries, so you'll come across the word orthopedics department only. So why it is so? So ortho means it is orthopedics. This definition is not a straightforward definition like traumatology. So ortho means straight. Pedics, it originates from the word. So child, pediatrics, pedics, children. So what does it mean? So predicts means what happens. So it is also this word is first used in a monography when a person was addressing to kindergarten teacher, explaining them to help the children grow straight, like to prevent them, sit straight, all the habits, so that what happens, children will grow straight. So the word was used first in that part. Later it is taken into this field of medicine. So how to define this thing? So it is not a straightforward definition. It is a section of clinical medicine. Once again, the same thing here. So it is a part of clinical medicine that studies about what happened. It is going to study about disease. So if there is going to be a disease, there is going to be etiology and pathogenesis. It's going to be part and parcel of it. Yeah. So orthopedics is a clinical medicine that studies about etiology and pathogenesis of diseases of the musculoskeletal system. Other words are same, devising ways of diagnostics, treatment, and prophylaxis. So example, diseases. Yeah. So what things can be studied? You'll be studying maybe about osteoarthritis, osteoporosis, maybe, yeah, some dysplastic, some type of dysplasia, maybe, yeah, or maybe for an example, scoliosis, deformation in the foot, and so on. Anything that leads to what? Any kind of disease that is developed in what? Musculoskeletal system. So if you want to put it in another way, anything that is cold type of injury, yeah, it becomes orthopedics. Anything that is acute, yeah, it comes under trauma. I hope you understand this definition. Any questions on this definition, doctors?
No, sir.
Thank you. So everybody understood, yeah, what is trauma and what is orthopedics. When you start this academic year, yeah, mainly you'll be studying traumatology. In the first semester, in the second semester, you'll be studying about orthopedics. So as been defined, so next thing in any subject is to know how old this field of medicine it can be. So here we can see some proven evidences that we can see over here. Like what is available, yeah, from 4th to 3rd BC, yeah, there is before Christ, yeah. So we can see what happened during Hippocrates, yeah. So reduction of a dislocated joint, yeah. We can see this picture already, yeah. So how shoulder joint dislocated, how people try to reduce it. So this techniques was available, yeah. So shows this field of medicine may be evolved in this time of period. So in the same time also during that we can find also in Russia. Some in works in vases, yeah, that we can see what other people try to do reduction and an application of splinting in case of a traumatized patient. So once again, to show this field of medicine is old field of medicine. Talking about this two picture, I read in a orthopedic book. So this author went forward to tell about how old is this medicine. He tried to tell about two theories of evolution. How many of you know theories of evolution? What are the theories of evolution that come across in your head, doctors? From your biology, maybe. Who can tell me what theories of evolution you know? Hello? Doctors, can you all hear me? Hello?
Yeah, we can hear you.
Yeah, so I give a question. So what are all the theories of evolution you all know, you guys know? Any theory you all, huh?
Maybe cell theory.
Cell theory, okay. And Darwin's, yeah, so very good. Yeah, somebody remembers about Darwin's theory of evolution. Yeah, next, what else? That's all, yeah. So basically, there are a lot of theories. It can be one theory talks about evolution theory, yeah, that man came from animals. Yeah, if you want to talk about that theory, yeah, so man was like, you can see if you go to some archaeological museum, you can see some apes, yeah, walking 4-footed animal try to walk with upper limb and lower limb, yeah, with all its limb. After that, what happened? You can see slowly what happened. It tried to stand straight with the help of a support. So in order for a 4-footed animal to stand straight, it would have needed a support. Yeah, it would have needed a support. So maybe, yeah, from there, they tried to tell about, okay, yeah, so in those time itself, what happened when person 3-4-footed animal to become a 2-footed animal, it would have needed a support. So this field of medicine, yeah, would have originated in that time. The author went forward and he described next theory, what happened, evolution theory. Yeah. So if evolution theory talks about there is a God, yeah, he took a clay and made a person, and then he made the person to sleep. And then what happened? He made operation, yeah. he took his rib and made a woman. So you can see already, yeah. So the first surgeon, yeah, that did some surgery on a man, it involves bone, yeah. So sometimes we used to say as a joke, yeah. So we are following God's profession, yeah. So God is the first orthopedic surgeon, yeah. So something like that to say this field of medicine is very old in a hypothetical way. But logic, but when we talk about more theoretical, more practical way, you can see now we live in a modern society. For an example, you can just press a button, yeah, I think in your phone, yeah, people deliver pizza to your house, maybe, yeah, deliver food to your house, yeah. You just press on another button, maybe you will just sleep, don't know where, yeah. So here technology is there, everything is there at your doorstep. But if you take our forefathers, or you can see in your history, yeah, people live in jungle, people lived in caves, don't know, from the evolution of human being for long centuries, yeah. You can see people lived a hard life. So when we talk about people living a hard life, they would have had injury, yeah, and of course these injuries, people would have had different techniques to handle them. So to say what happened, though we have some like 3rd to 4th century BC, yeah, but I believe that what happened, this field of medicine has originated long before, like when man was like already in this world, yeah. So he would have had trauma and medicine was there, but it was not documented maybe time, yeah. So from the past to now, yeah, more closer time, yeah. So I believe you would have came across Nikolai Pirogov, yeah, and his invention anatomy, yeah. So we can see his wide field of what happened in intervention, yeah, into the modern medicine, yeah. Next, if you come across in the future, in 1 year time, yeah, or 1.5 year time, you'll be 2 years time, yeah. You'll be going back to your country when you work, yeah. You'll always hear about a person. If you hear Russia, orthopedics, you will hear a word, very famous word. It is called Ilizarov, yeah. So his invention, yeah, this is called device for external fixator, yeah. It is known known in all over the world, yeah. So this is a very good device, especially used to fix multiple open fracture, comminuted fracture. Nowadays, it is used for cosmetic purposes, yeah, to make person grow his height. Yeah. So this invention is known, yeah. So and inventions keep on continuing already, yeah. So currently also in Russia, you know, like how to say, when we talk about joint replacement surgery in 1970s already, a lot of implants were invented here, but they haven't gone to production wing. But field of what happened. Orthopedics, they have a very big history of inventions, yeah, and currently also there is very big line of inventions. When you come to our department, yeah, please ask teachers, yeah, so they will even in our department what we are doing, which will be a good thing to you all, and you all can join us also in research work. Yeah, so we will talk about this thing as we continue to finish our lecture at the end. Next thing, next. So here, so after this, let's get into some common terms. Next term that you might come across in this field of medicine is called traumatism. This is used for statistic purpose. So you can see statistics here. We can see here the accident is the reason for what happened. 3 million person of death of what 3 million person according to WHO annually. Yeah. So this gives us a hint. What happened? To check, wow, 3 million people, you can see 3 million people is, for an example, some country's population already, yeah, finished already. So traumatism means what? It's the totality of trauma repeated for a certain circumstances at an identical group of population for a certain period of time. So how to interpret it in a practical way? So for an example, let's give some example. Yeah. So for an example, they found out for currently in some particular highway, very frequently what happened? Accidents are happening. So what happens? There are a few departments. Once Ministry of Health will get what happened, report that what happened, too many death is happening because of a road traffic accident. Then they will talk with Ministry of Transportation, don't know what else, transportation or what happened, road or whatever thing. Yeah, they will see why too many accidents are happening in this area. So once again, they'll investigate the condition of the road. Next, they will come and investigate what is the reason. So they will start putting what happened, speed limit maybe, they'll put traffic light, maybe they'll put speed breakers maybe. Yeah? So to prevent what happened, occurrence of this traumatism. Did you understand, doctor? Understood the word traumatism and how it is how it is applied in practicality. Everybody understood this? Hello?
Yes, sir.
Yes, sir, understood.
So we can put it in our practical life also. Like for an example, you see today in this current century, if you want to build your own house, you can't simply go just build your house. Yeah, before you want to build your house, you have to what? Get proper plan approved. Yeah, then only what happen in your plot you can build your house. Simply they will not come and give you electricity. They come and check everything. Simply they don't give water or sewage system into your building. Yeah, so everything needs approval. They come and investigate everything. How is the building? Is the building capable for people to live or not? Yeah, so this is a very good statistic thing. Yeah, so when you talk about traumatism, see, this is a very old statistic. To talk about, it explains some content that is very good. So only I still keep it over here in this lecture. So here, for an example, world time in Russia. Yeah, so they classify traumatism into two groups: occupational and non-occupational. Yeah. Non-productive traumatism. So those time mainly it is industrial and agriculture. You can see it occupies only 10% of traumatism. Rest everything, 90%, it is occupied by non-productive traumatism. And we can see here in this 90%, what happened, mainly it is occupied by what? Household, yeah, in the street, in the road, intentional, maybe sports and children. So why you think household is very dangerous? Why it takes so much? And why industrial and agricultural is very less? Any idea, doctors? Any idea, no? Hello? Hello? Doctors, I need some feedback.
There are safety safety rules in place for industrial and agriculture.
Yes, very good. Yeah, so we can see in industries, yeah, you can see almost they control how much amount of waste they release into the air. Everybody have to wear safety equipments, yes or no, starting from head gears, gears to protect their eyes, gloves, shoes, everything. Yeah, so traumatism is limited. So only we see over here. But if you take household, what happens? Suddenly you open somebody's house door, what happens? You can see frying pan will fly on your head. Yes or no? Hello? Yes or no? Hello? Happens sometime. Frying pan flying. Only in movies, yeah? Okay, there is some technical problem. Yes, only my camera is not on. I hope it will be solved, and then maybe in the coming lectures it will be on and will be more interactive. So, so this is how it is classified. Yeah. So this will be an assignment to you all. Yeah. Find in your Ministry of Health. Yeah, you'll find traumatism statistics in your country. Yeah. So you should know your traumatism statistic and how your government is effectively stopping it from progressing, because all country has Ministry of Health. Under the Ministry of Health, yeah, so they take statistics and they take statistic of traumatism and they try to reduce it as much as possible. Next is traumatic disease. What do you mean by traumatic disease? It means what? It is a structural and functional injury of what organisms homeostasis caused because of what mechanical damage or their combination because of an external force. Yeah. So this is called as what? Traumatic disease. So anything that is affecting organism homeostasis, we call it as traumatic disease. So we define a term called as trauma. Trauma can be of Trauma means it is the effect of an external factor. It can be mechanical, chemical, or thermal, any other condition that is resulting in what happened. What does it cause? It results in morphological, that is structural, and also functional damage to a tissue. So if there is damage, so any fact that cause what happened, structural and functional damage to a tissue, we call it as what happened, trauma. So when we talk about trauma, trauma can be divided into two groups. Trauma can be an acute trauma or chronic trauma. So what is acute trauma? That is a single state damage. See, for an example, a hammer fell on patients. Somebody hit a person with a hammer. What will happen? For sure, he will have, if it fall on his chest, he might have what happened, fracture of rib. Yeah, if it fall on his skull, maybe he can have what, starting from what happened, epidural hematoma, maybe he'll have a bruising of his skull, maybe concussion or contusion injuries can happen to his skull already, yeah, head. So this is acute. So external force act on a person, because of the external force, there is a damage. So this is called acute trauma. What is chronic trauma? You would have came across this chronic trauma in occupational disease. Maybe you will have it in this semester, maybe when you study physiotherapy, I don't know. Yeah. But so what is this chronic trauma? So external force is acting on a person, but that external force is not powerful enough to cause damage. That means for an that force is not powerful enough to cause a damage. But it does some change. Yeah. So we can see, for an example, sports professional. Yeah. So they always train their muscle tendons. Yeah. So they might have a frequent joint pain, yeah, but there is no rupture of any tendon or ligament. So maybe after long time, repeatedly, they have pain in the joint. Maybe after that, maybe they stop and do some, excuse me, do some exercises. Maybe in that period of time, maybe they'll have injury. Yeah? So in that case, we can think about chronic trauma. Next thing, if you take, so we studied about trauma and its nature. Next, we should try to think about how the trauma can happen to a person. So we call it as mechanism of injury. So there are two mechanisms of injury. One is called direct and another one is called as indirect. What is direct mechanism of trauma? So we can see here in this picture. External force act in a place, exactly in the place there is an injury. This is called direct mechanism of trauma. So the next mechanism is called as indirect. What do you mean by indirect mechanism? So let's give an example. Patient has a rotational type of injury. Yeah. So for an example, here in his lower limb, yeah, patient had a twisting force in his leg. Because of the twisting force, what happened? He had a spiral fracture or comminuted fracture in the bones of his leg. This is called indirect mechanism. So how to define indirect mechanism? Force impact on a part of a body. And what happens? That force is being transferred to a distance away from the impact, and you see injury somewhere away from it. This is called indirect mechanism. So let's try to put it in a very simple way. Patient jumped from height. He landed on his foot. When he landed on his foot, for an example, patient is jumping from the first floor of a building. So it is like 3+ meter height. Yeah? He's jumping from the first floor. So when he tried to jump on his foot, maybe he has abrasion or lacerating wound in his foot. This is direct mechanism. But what happens is when he lands on the foot, the force is being transferred in the whole lower limb and it went to his hip joint. Maybe he had a fracture of neck of the femur or dislocation of hip joint. This is called indirect mechanism of trauma. Understood? Understood, doctors?
Yes, sir.
Or another indirect mechanism I can explain you. See, you are a driver. in a car. Yeah, so we call it as dashboard injury. Yeah, so in front of the driver's dashboard. Yeah, when the car hits on some vehicle, what happens? The dashboard will go hit the patient knee joint. So the force will hit on the knee joint. But what happened? Because of the impact on his knee joint, yeah, he's sitting, yeah, 90 degrees, yeah. So it will impact on his knee joint. That force, so imagine. So he's sitting like this on a dashboard, yeah, somebody is sitting like this, yeah. His leg is going down, yeah. So impact will hit on his knee joint. Here exactly the force dashboard is going to come and hit him. This force is going to be transferred, and in his hip joint, you'll have dislocation or fracture. This is called indirect mechanism. So force is acting in one place, the force is being transferred, and distance away from it, we have an impact. So we have impact in this region. So this is called indirect mechanism. I hope you guys all understood. Yeah, doctors?
Yes, sir.
So it is very important for you when you examine a trauma patient, you should ask this question: how did you get the trauma? So the patient will explain a scenario. How? So you should assume. He will tell, I got hit by a trolley. Yeah. So he got hit. Exactly in the hitting place, got injury. Very good. Yeah. So you're finished. Next patient will tell, I fell from height. You're very serious. Wow. When the patient fell, for an example, imagine the same patient fell from a height. You see a bleeding wound, you see a wound, bleeding, blood is coming out from here. You are very, maybe you're very curious. I want to stop the bleeding, help the patient only in this part of the body. You try to help, but you will what? Wrongly diagnose your patient. Maybe what happened? He might have somewhere here in this region, hip region, he has fracture. Maybe he can have compression fracture of vertebra. Maybe he'll fail in such a way. Maybe he also has some head injury. Yeah. So if you don't take proper anamnesis, simply focus on this part of the body where it is bleeding, you will misdiagnose the patient. Maybe patient will die because of some other thing. So mechanism of injury helps us to rule out this condition. Next thing, for an example, for if you know very good topographic anatomy, so where the patient had an injury, if you concretely know, yeah, in that localization got some nerve or artery or vein, we can rule out if this fracture happened in this region, will there be injury to neurovascular bundle or not? You can think about it. So we can try to prevent further complication also. So that's where mechanism of injury is very useful. Next thing that we can see over here in this picture, yeah, some common definitions that you would have came across from starting from your maybe second year of your medical studies. So simple definitions, but you should try to remember, very common that you can hear in our trauma, orthopedic trauma field is what? Bruise. I got a bruise, bruise. So why the bruise happens to a person? A bruise happens because of direct mechanism of injury. External object come and hit a person directly on that region. Yeah. So it is a closed damage. So when you get a bruise, you know, you don't see bleeding. It is a closed damage arise as a result of a short-term direct impact of an external object. It accompanies with subcutaneous hemorrhage. That's what you see, this redness, hyperemia in the region, yeah. But the anatomical integrity of the hurted organ is not damaged. So there is no anatomical integrity damage. So everything is preserved. So only you might see, yeah. So after any trauma, yeah, within hours, you can see the injured site, you might see hyperemia. So patient is getting bruise. Let's get to the very other side of the bruise. We call it as crush. So in the crush, what is happening? Once again, it happens because of a direct mechanism of trauma. So external object fell on a person's limb. Yeah. So because of that, what happened? It will damage the anatomical integrity of the hurted surface. You will see bleeding. Yeah. So it depends upon what crushed the patient. Yeah. Maybe a truck ran on a person. Maybe what happened? You will see a porridge. You will see a porridge. That's all already. It depends upon what heavy object ran on the person. Yeah. That will define what type of crushed injury you will have. Next, you should. So I believe you understood the difference between bruise and a crush. Yes or no, doctors? Hello.
Yes, sir.
So in a simple way to define bruise and a crush is you take a bruised muscle. Yeah, put it in a electronic, put it in a microscope and see. Yeah, so where you will see muscle fiber. Yeah, muscle fiber. Beside it, there is blood. So that is good. This is how it looks like. But if you see a crushed muscle in a microscope, you can differentiate. It will be like you can't differentiate. Is it a muscle or what it is? You can't distinguish it. So this is how crush look like in a histological picture. Next condition is called as crush syndrome. Yeah, a separate topic is given to this condition in our academics. So what will happen? I told you in crush, it is a short-term compression. Yeah, but what is happening here in crush syndrome? It is a massive long-term compression of soft tissue. Yeah, especially when we have a natural calamities, maybe building collapse, somebody get trapped under a building for a long time. Yeah, especially its upper limb or lower limb will get trapped. So what will happen to the limb more distally? They will develop what happened, ischemia. Moment what happened, patient is evacuated from this region. What happened? This whole ischemia, yeah, that developed in the region, yeah. So there is very severe endotoxin that is accumulated in that limb. Maybe, yeah, it will get into his centralized circulation and cause what happened, auto intoxication. So it can lead to adrenal failure, yeah, and further on it leads to multiple organ failure, yeah. So when in that condition we call it as what, crush syndrome. So try to differentiate bruise, yeah, simple form of energy without damage to anatomical integrity, crush. Very bad crush syndrome is more severe actually. Next, let's get into much more common type of injury that you'll be seeing it in your everyday practical life. So one of the things that you can see is sprain. Sprain, you'll be using it every time in your practical life. I sprained my ankle, don't know, I sprained my, what else? You'll be using it. Yeah. So what do you mean by sprain? If you take a muscle fiber, partially the muscle fiber is damaged. Elastic fiber, I mean, yeah. It can be tendons, yeah. So if partially the elastic fiber is damaged, we call it as sprain. So sprain has 3 degrees: first degree, second degree, and third degree. First degree of sprain is damage to 1/3 of the elastic fiber. You should write it down. Second degree is until 2/3. Third degree is a complete tear of a ligament. Yeah, we call it as what happened, third degree sprain, which also can be used as a word rupture. Third degree is equal to rupture. Yeah, so we can see over here what happened. A complete tear of the Achilles tendon happened. Yeah, it's a third degree of sprain. So what do you mean by rupture? Rupture is what happened. There is complete loss of integrity. Yeah, so when there is completely what happened, the elastic fiber losses its attachment here. So we use this word called as rupture. Yeah. So very frequently where it can happen, for an example, in Achilles tendon, maybe patient try to carry heavy weight. Maybe patient can have a rupture of what, biceps tendon, maybe. Yeah. So sprain and rupture. Especially when we talk about sprain, we use it to tell about ligaments. When we talk about muscle, we use the word called as strain. So strain, we use it to explain what happened when there is tear of what some fibers of your muscle. Next thing, so we finished with elastic tissue injury. So next, let's come to the bone. What can happen to the bone? Only one thing can happen to the bone. You should remember it forever. What is a single thing that can happen to the bone in relationship to trauma? This is called fracture. Fracture is the only thing that can happen to the bone. So what is fracture means? Damage to the integrity. If this word integrity is hard, you can use the word called as continuity of the bone. So we can see over here, you can see this bone, this fibular bone is continuous. But if you take tibial bone, continuity of the bone is broken over here. So we call it as fracture. So we can see the same scenario over here. Fibula, the bone continuity is not damaged, but what happened? Tibial, the bone continuity is damaged. So we use the word called as what happened? Fracture. Understood? Definition of fracture, doctors. Hello?
Yes.
So please don't use in the word they broke the bone. No, we should use the word he fractured. Yeah, he got a fracture, something like that. You should try to use this word already. Next thing. So this fracture happens only to the bone. So next, let's get to the next thing called as dislocation. Synonym of dislocation is called luxation. So in people who come from Latin people who use the word, use the language that originated from Latin, for them it is, they don't use this word dislocation. They talk in commonly, they talk what happened, this word called as luxatio, yeah, so, or luxation in English. So what is luxation, or the English alternative synonym dislocation? This condition happens in joint. Please try to write this thing. It happens only in the joint. Please try to write it somewhere, highlight it and keep it. Yeah. So dislocation is a condition that happens to the joint, only to the joint. So what is dislocation? So, so simply to define is complete loss of articulation. So if you know a joint composed of two bones. Yeah, if you take a joint is composed of two bones. So if it should be, the joint should be like this. Yeah, like it should be in this way. But if joint completely loses, completely got disconnected. Yeah, so complete loss of articulation. So here, this is one articulating surface, this is one articulating surface. Yeah, it has to be like this in a patient. Yeah, but what happened here? Complete loss of articulation is happening. Yeah, so we define this condition as dislocation. So mild form of it is called subluxation. What do you mean by subluxation? Partial loss of articulation. So we also call articulating surfaces congruent surface. Yeah. So we partial incongruency is called subluxation. Yeah. Incongruency is called as what happened? Dislocation. Any doubt about the word dislocation and subluxation, doctors? Any questions?
No.
No. So I hope you will use this word appropriately. Yeah. So fracture will happen always to the bones. Dislocation is a condition that we can see. Yeah, we can see over here in this patient. Yeah, this is how normally glenoid cavity and head of the humerus should be. But here, what happened? Head of the humerus is completely out of the joint. Yeah, here we can see a radial head should articulate with what happened with capitulum of your humerus bone. Yeah, here what happened? The parent tried to lift the child with the help of what happened? Hand, just holding the hand. Yeah, so what will happen? That force is quite good enough for the head of the radius to come out of its annular ligament, and you will get dislocation. The child will be crying, and child will have limitation of movement in the concrete joint. So this is this condition. Next, as we discussed about a bone here, so let's think about, let's study a little bit more in detail what a bone can do. If you take a bone, yeah, a long tubular bone, yeah, you put the bone vertically, you can mount a car on it. The bone is not going to break. So if you can take a car, average weight, it will be 1.5 ton to 2 tons. Yeah, it goes already. Yeah, so bone is a very strong material. Next thing we can see, yeah, if you take a bone, yeah, put a cancel screw, yeah, cortical screw, yeah, and not up and hang a weight. You can hang how many weights? 250 kilos. Like some people are in your group, maybe 55% can hang on it, or 4 people can hang on that thing already. Yeah, so to tell what happened, bone is a very strong material. So if you want to break any bone, there should be a concretely high energy. So only what happened? Fracture, yeah, fracture. We can categorize into two categories, yeah. So for fracture that happened because of high energy trauma, a fracture that is happening because of what? Low energy trauma. So what is low energy trauma means? That means you fall from your own height. Yeah, you fall from your own height and you break your bone. So the force that is involved in breaking that bone is so low. So that is called low energy trauma. So when you have low energy trauma, so you should ask the patient how you got the trauma. Patient tells, I was inside the kitchen, or maybe what happened in the toilet. I slipped and fell and I couldn't get up. So here this is called, we also call it as pathological fracture. We call it as what fracture? Pathological fracture. This is a hashtag. Yeah, you use the word hashtag nowadays, but hashtag is a short sign to write fracture. So hashtag, when you put, that means what happened, patient has a fracture. So low energy trauma. So if patient has a low energy trauma, you should think why this patient had this low energy trauma. So why it is? Patient has what? Osteopenia state, maybe patient has osteoporosis. That means what happened? Bone became porous. Yeah, our bone became weak and brittle. So what will be the condition that can lead to this thing? Yeah, it can be because of what happened, osteoporosis of different origin. Can be calcium or vitamin D3 deficiency. If you take woman postmenopausal condition, can be maybe oncological condition. Patient is under steroid, maybe. Yeah, patient is what happened. Patient is unconscious, coma patient. Yeah, he's lying on bed for a long time already. Yeah, so all this thing triggers already. So please think about this condition. Understood, doctors? Hello. Will you pay attention? Will you pay attention, doctor? So please write a note and think about this condition. Whether patient has a high energy trauma or low energy trauma. So all low energy trauma, we think about fracture as pathological fracture. So please try to write this point and keep it. And you should know, to break a bone, it is very hard. If you are a non-vegetarian, yeah, try to bite a bone of a cow or a bone of a lamb, you can't easily bite it. You try to bite, maybe you'll break your teeth. Yeah, so they are very strong. So if this is a little bit of revision from your histology, maybe anatomy, in your first year, yeah. So types of bone, there are a few kinds of bone. Trabecular bone, yeah. So what is trabecular bone? We call it as spongy or calcaneous bone, yeah. So spongy bones, they are located especially in the metaphyseal region. In the metaphysis, we can find spongy bone. It looks a picture of it. Let's see. We have a picture here. No, we don't have. So it looks like a sponge, yeah, spongy bone, trabecular bone with a lot of trabecules, air spaces. Compact bone, we can find in the diaphyseal region. It will be like very compact. Only there will be a bone marrow canal. Yes, in the diaphyseal region, we see what compact bone. Woven bones are the bone, they are immature bone or growing bone. We can put it as it. So these are three variants of bones. Yeah. So if you take a long bone that we can see over here in this picture, we classify the long bones by their structure. So here, proximally there is articulating surface and distally there is articulating surface. This region we call it as epiphysis. Next, below the epiphyseal region, yeah, the region where we have the spongy bone, proximally also we'll have, and distally also we'll have. We call it as metaphysis. What is it? It's called as what? Metaphysis. Sorry, 1 minute. We call them as metaphysis. In between the metaphysis, we have diaphysis. Diaphysis is so long. Inside the diaphysis, we'll have a bone marrow canal. So inside the diaphysis, if I make a cross section in this thing, you'll find what bone marrow canal. Inside the bone marrow canal is what happened. You have your bone marrow already located already. Yeah? So diaphysis is so long. So we divide the diaphysis into superior third, or we can tell upper third. Yeah, upper third, and we can have middle third and lower third. So this is how we divide a bone. So this can be even classification of division of a bone. Please try to remember these parts, because what happened in the future, you'll be writing your diagnosis. So in the diagnosis, we should tell where the fracture is localized. So in order for us to know the localization of the fracture, we should know this thing. Yeah? Then only what happened. So if fracture line is going somewhere here, what happened? We will tell the fracture is localized in the middle third of the diaphysis. If fracture line is going somewhere here, we can tell fracture is localized in the distal metaphysis or proximal metaphysis. If fracture line is breaking the articulating surface, then we say fracture is in the epiphyseal region, or we call it as intra-articular fractures. So, what is an intra-articular fracture? Fracture that is going to break the articulating surface. Yeah, that is called intra-articular fractures. So, fracture that is going to happen in the metaphyseal region that we can see over here and here. Yeah, that red area. Yeah. So, fracture that is going to happen in this area and this area that is not damaging the articulating surface, yeah, but it's happening in the metaphyseal region. This is called as what? Extra-articular fracture, because it is not happening inside the joint. It is happening outside the joint. So it is called as what? Extra-articular fracture. Any questions on this explanation about what happened? Localization of fractures, doctor. Any questions?
Sir, can you repeat the location of the intra-articular fracture?
Okay, so let's try to tell. This is the articulating surface. Yes or no? This is the articulating surface. If the fracture is going to break this articulating surface, yeah, the fracture line goes like this, yeah, or fracture line going like this even, yeah. So what happened? It broke the articulating surface, yes or no? So we call it as intra-articular fracture. Understand, doctor? Here, what happened? Intra-articular fracture always involves what happened? Our epiphysis. Understood?
Yes, sir.
Next, let's get to what is extra-articular fracture. Extra-articular fracture. I will leave this line like this itself for you to understand. Yeah. So this thing happened here. It is the intra-articular fracture damage. So let's go up. So this is the articulating surface of this bone. Yeah, articulating surface ahead of the femur. Now, fracture is happening over here like this. For an example, this is surgical neck of the humerus. Fracture happened here. Did it disturb the? Did it destroy the articulating surface? No. Understand, doctor? So articulating surface is not damaged. Yeah. So we call it as what happened? Extra-articular fractures. So normally what happens? Fracture that is happening in the metaphysis is extra-articular. Understand, doctors?
Yes, sir. Thank you, sir.
In some scenario that we can even take our bottom picture as an example. Fracture line is let me use another color pen. Yeah, fracture line that we can see in the blue, both the blue lines. Plus, what is happening? Fracture line just breaks and goes like this. Yeah, so it is not only damaging the epiphysis, it is also damaging what happened, our metaphyseal region. Yeah, so we call it as what happened. It is an intra-articular fracture, but damage what? Epiphysis and metaphysis. So we use what happened? Intra-articular fracture. So you use the word intra-articular fracture. This is called distal part. Yeah, distal. Use the word distal. Yeah, I will take distal. Meta-epiphysis. META. Meta and epiphysis. EP. You will write like this. Understand the epiphysis. Understand, doctor? Hello. So it is this fracture that is disturbing metaphyseal region and the epiphyseal region. So we call it as what happened? Fracture of what? Meta and epiphysis. Clear, doctor? Meta epiphysis. Intra-articular fracture of what? Distal meta epiphysis. Understood?
Yes, sir.
I hope you all understood clearly this thing. So you should know where the fracture localized. Okay, doctor. So next, so we defined. In beginning also I told about bone. Yeah, bone is not just a cell or a tissue. Bone is an organ by itself. Why it is an organ? Because what happened? It has vascular function inside it, reticular function inside it. There is proper bone tissue, bone marrow is present, and also cartilage. Yeah? So it makes bone as an organ. Yeah. So what are the main function? We already told it gives mechanical function. Yeah. That means the movement and everything. Yeah, it has what biochemical function. Yeah, calcium very important. Homeostasis and metabolism. Yeah, inside the bone marrow we have what stem cells. Yeah, hemopoietic stem cells. Yeah, so hemopoietic function and it all goes already. Yeah, so bone is a very important organ in our body. Yeah. If you talk about bone, what the bone is composed of? Bone is composed of two components. It composed of organic component, and it composed of mineral component. So when you talk about this organic component, it occupies 30%. Mineral occupies the rest 70% in average. So in this 30%, only the living part of the bone is only sorry. I draw very badly. So the living part of the bone is only what happened? 2%. That includes what? Osteoblast, osteocyte, and osteoclast. You should memorize this word. So osteoblast, osteocyte, and osteoclast. Yeah, this is the living part of our bones. Rest everything. Yeah, rest everything that is over here that we see over here is what already non-living component. So we can see out of 100% of the bone, in this 30%, only 2% is cells that is living. So next is what happened. Then on this next organic component is what happened. 98% is what happened. Collagens, different type of collagens, and non-collagens and osteocalcin. Yeah. Next 70% is what happened. Your mineral component. Yeah, different groups of what hydroxyapatite. Yeah. And small microelements like magnesium, sodium, fluorides, and chlorides, and other microelements forms the bone. So let's study what these components are going to do. Yeah. So here, histological picture of a compact bone. See, if you take a compact bone, there is no trabecules. It is like continuous structure. Surrounding the bone is what happened. You see what periosteum. Yeah, that surrounds the bone. Yeah, here on the periosteum, there is a very good vessels, and blood vessels will enter the bone through your periosteum. If we take a bone, and make a section, cross section like this, you get a picture like this. You get a picture like this. In that section, you'll get a picture. You see some canals. These canals are called as what Haversian canals. This is a longitudinal canal. They'll be running longitudinally. So let's draw. If this was the bone, I made a cross section like this, and I'm seeing this thing like this. So what is happening here? That means what happened here inside the bone, what happened? Haversian canals, you will see here what happened inside them is what happened. How this red line, this is a capillary, it will be running inside these Haversian canals. So different, once again, what happened? Electronic microscopic picture of what? Of bone structure is being explained over here. Next thing that we can see, the cell that we talked, this is called osteoblast. Yeah, so remember the word blast, maybe blast, something like I don't know how to put it. Yeah, so one very big-eyed some structure is called osteoblast. So we can see osteoblast in the bottom of the. You can see this is like a bone structure. Yeah, osteoblast. What happened? It drops collagens. Yeah, so osteoblast is the main structural unit of the bone, that helps in what? Formation of bone or mineralization of bone. So we can see it synthesizes collagen, and other bone protein on which what happened? Calcification happens and bone is going to be formed. So this is our osteoblast. Next, we can see osteocyte. Osteocyte is the structural functional unit of a bone, like how you have neurons for nerve, nephrons for kidney, for bone. Osteocyte is a structural and functional unit of a bone. So we can see osteocyte, cross section, and it has long flagella-like structure. It will spread, don't know how long, it will be spreading very long. On this structured, collagens will get deposited, and then what happens? Calcium and other minerals deposit and forms your bone already. As long as there is osteocyte present in that localization, that bone is the viable bone. When this osteocyte die, that bone become a dead bone, and what happened? Once again, what happened? New bone will come, or a new bone will grow on that region. See the next thing, next word, clast. Remember the word clast with clusters, cluster. Try to remember one word, either osteoblast or try to remember the word osteoclast. So I think better remember osteoclast, the bad guy, in our bone. Why I say it is a bad guy? You see, it is cluster. You see, there is 1 eye, 2 eye, 3 eye, 4 eye, something like that. Nucleus. So in the bottom, we can see this is the bone level. It should have been the bone level. What happened? It already caused erosion. So there is a bay of absorption. So what does it do? It causes what happened? Reabsorption of the bone or demineralization of the bone. So it formed from what happened? Macrophageal type here. So it caused what happened? Demineralization of the bone. So of course, what happened? There is a balance between osteoblast and osteoclast in our body. But when you take children, there will be more in the growing age, there will be more osteoblast activity, but it will be balanced in both sides. But when we become old, there will be only more osteoclast activities. Post-menopausal, more osteoclast activities. In male, maybe after 70 years time, osteoclast activity, which causes demineralization and osteoporosis. So here, once again, what happened? We can see osteoclast. What does it do? It causes bay of absorption. This is the cortical bone, and osteoclast is absorbing the bone. Here, there is an animation. This animation talks about a longitudinal section and a transverse section of a bone. Here we see osteoclast making a hole, and it goes here. It is forming an Haversian canal. Then we see deposition of osteoblast. So osteoblast, you already see what happened. It forms the concentric circles in the Haversian system. After osteoblast moves, you will see what happened. Capillaries will come in, and what happened? It goes already. So this is how Haversian canals are vascularized in a bone. So schematically explains. So when we talk about developmental bone cells, so here hematopoietic stem cells, it becomes pro-osteoclast and forms osteoclast. So next we have primitive mesenchymal cells. These primitive mesenchymal cells become pre-osteoblast. Some will modify to become osteocytes. Some will modify to become osteoblast and cause mineralization. So precursor cells is primitive mesenchymal cells already. So here schematically explained already from where the bones are developed already. This schematic picture you'll be seeing almost in a lot of textbooks. So what is seen here in the first picture? This is a resting zone. This is a resting zone. Everything is fine. Everybody is resting. So everything is fine. At one point, what happened? Osteocyte died. And what happened? We see deposition of osteoclast. So osteoclast got deposited. So when osteoclast deposited, what happened? They cause reabsorption. They will reabsorb until viable cells. After this, what happened? After osteoclast will be replaced by osteoblast. Osteoblast will work, mineralize the bone until the resting surface. You see it mineralized until the resting surface. So periodically what happened? Dead bones will be removed. And what happened? You see mineralization. So this process keep on happening in our body. When we talk about the bones, growing bones, we call them as callus or soft bones. So there are different types of soft bones are available that we can see over here. That is explained over here. So immature callus. What is this immature callus? Yeah. So immature callus, where does it grow? So if this was the bone, and what happened? The bone got fractured. Yeah. So after the fracture, yeah, ends of the bones are like this. So what is this immature? What is immature callus? Immature callus will grow where bone is coming in contact with other bone. Yeah, this is called immature callus. Next is called periosteal callus. What is periosteal callus? Periosteal callus will grow on the periosteum. So it is going to grow on the periosteum. So this is a good callus. So these two are good callus. Next, we have central callus. What is this central callus? This is a pathological type of callus. This callus will grow in the bone marrow canal. And what happened? It is going to close the bone marrow canal. So this is a pathological callus. Next, the last variant, we call it as paraosseal callus. That means calcification happens in the bones, calcification happens in the bone, on the muscles, tendons, ligaments, all the structure that is surrounding the bone. Yeah. So we call them as paraosseal callus. So we have two physiological good callus and we have two pathological callus. Any questions, doctor, so far? Doctors, do you all have? Okay. Next. So if we have if the bone breaks, that is, if there is a fracture, the bone is going to grow back. Whether we are going to intervene in it or whether we don't intervene in it. Yeah. For an example, you see a street dog, yeah, some vehicle ran on it, it had a fracture, nobody pays attention to the poor dog. Yeah. But what happened at some part of the life, the dog stands and walk or limp and walk, it starts walking already. Yeah. Why? There is no medical attention done, but it happens. This is a physiological process that happens in our bone. Of course, you will see the animal's limb will be deformed. It is not going to be looking like how it was before the fracture. So because why no medical attention was given to it. But thank God what happened, we human beings, we have what medical attention. Yeah. So when you have a fracture, yeah, you consult orthopedician, yeah, orthopedician do operation, yeah, restore the alignment of the bone, fixes the bone. So you'll have what? A proper alignment of bone, and what happened? Bone grows correctly and you don't have any problem. So what are all the stages? So first stage, when the bone breaks, the first stage, what happened? The Haversian canals also breaks. You know already inside the Haversian canals, what happened? We have the capillaries, so there will be very big blood, so you'll have hematoma. This is the first phase of consolidation of the bone, first phase of healing of the bone. So this phase, what happened? We see hematoma. Next, if you see the hematoma, this hematoma will start to proliferate. So it will, in 2 to 3 weeks time, yeah, approximately 10 to 14 days time, what happened? You see the hematoma will proliferate. In the region, you will see formation of what? Fibrous callus will happen. Next, after that, on this fibrous callus, just now we discussed, yeah. So on this fibrous callus, what will happen? Immature callus will grow. This fibrous callus will be modified, and you see what? Immature callus will grow. And what happened? It will close. So immature callus is grown already in this region. And what happened? It already closes the bone already. Yeah? So this is the third form, the fibrous callus. Mineralization will happen on the fibrous callus. You will see growth of an immature callus and little bit of a periosteal callus also will grow. So immature plus what happened? Let's try to draw in another color. Periosteal callus is grown over here. So only what happened? It bulged a little bit. Yeah. So what happened? So these soft bones are growing. So this is the third phase of healing of the bone. Next thing, the next phase we call it as consolidation. That is currently not present in English textbook here. We call it as consolidation. What is consolidation? If you use, if you are a baker, you understand the word consolidation is called hardening. So we see fracture, we see fibrous callus, fibrocartilaginous growth is happening here, and we see a soft callus. Yeah, when the soft callus hardened, that condition is called consolidation. So when patient has consolidation, what happens? The bone is completely united. That means what happens? Patient is ready to get full loading of the bone. The last phase of the bone healing, we call it as remodeling. So remodeling will take from months to years. So what happens? So what should happen? The bone was ideally looking like this. Yeah, if there is no fracture, bone should ideally look like this. But what happened? Bone a little bit bulged. So it takes time. During this time, what happened? You will see this excessive growth and all will disappear. Yeah, and bone will try to look like how it was before the fracture. So that condition is called as what? Remodeling or restoration of what? Architectonics of the bone. This is the last phase. So it will run from months to years. So any questions on the stages of fracture healing, doctors?
No, sir.
So you should memorize this thing. So there is no other go. Yeah, a simple thing is what happen after any injury. You see hematoma. Yeah, so that hematoma, what happened? Proliferates, forms fibrous tissue. Then what happened? Bone callus. Then consolidation, and what happened? Restoration of architectonics. See, so this word is called consolidation. So let's try to do some game with the word called as consolidation. Yeah, why we should do this thing? This is important. So what thing to do? So consolidation is a verb. Consolidation is a verb. So if it is in process, present continuous, if it is happening now, how to conjugate it? What will be the word? Present continuous, what will be adding?
Consolidating.
Very good. So you might come across in your clinical practice patient who has consolidating fracture. Today I have a fracture. After 1 month, I visit the doctor. He will not tell I have open or closed fracture. Yeah, he will tell that I'm having what? Consolidating fracture. ING. Understood, doctor? Next, if it is already finished, consolidation already finished, how to write it?
Consolidated.
Very good. So the next word is dated. Understand the EAD. If it is already finished, he is already healthy. I visit the doctor after 1 year time. He will not tell I have fracture. Yeah, my fracture is already united. So he will use the term what? Consolidated fracture. So you might have fresh fracture. You might have consolidating fracture, or you might have consolidated fracture. Understood, doctors? 3 variants of fracture. Understood, doctors? Hello?
Yes, sir.
Thank you. So we are done, yeah, with basic introduction to this thing. Yeah. Next, this is how this you should pay attention. How we should write case history. Yeah. So you'll be writing case history. Yeah. How to examine our trauma and orthopedic patients. So there is nothing big change. There is no big change from your propedeutics or surgery or any other case history. Little bit of alteration is given, and we'll give a stress on musculoskeletal system, where if you wrote a therapeutical case history or surgical case history, yeah, you will give less attention towards this part. But here in orthopedics and traumatology, yeah, we give more attention towards this part of the system. So compliance, I don't need to define. Compliance is what happened. Patient comes and tells about dissatisfaction about his or her health condition. So you write what patient tells. Simple as it is. Next is history of disease, anamnesis, morbi. Here you should give these questions. When you are getting anamnesis, morbi, you should tell where, when, how, why there was a trauma, why this thing, where it happened. Patient will tell the place. When it happened, patient will tell the time. Here he will tell the place. Here he will tell the time. How it happens, he will tell mechanism of injury. So you can tell it is direct or indirect. Why? It gives answer to a very big thing. Why it happened? Is it an accident? Is it an accident or an assault? Yeah. So if it is an accident or an assault, yeah, both we have to complain. Yeah, we have to make police complaint. Yeah. So here what happened? Accident. Yeah. Accident, is it criminally oriented, or it is simply an accident? Yeah. Or assault. Yeah. Of course, patient intentionally. Yeah. Intentionally, there was intention. Somebody tried to kill a patient. Yeah. or maybe it can be a suicidal attempt also. Yeah, so we should differentiate. So you see, these questions are very important. Yeah, because what happened? It is not just doctor is involved into it. Yeah, other part of what services. Yeah, that is like police department and other departments. Yeah, criminal department. Yeah, should be involved to differentiate those things. Yeah, so those things should be done already. So next thing that we should pay attention in our case history is who gave first aid to the patient, when, where, what was the result. So here we should tell first aid. First aid is given or not. So if first aid is not given, we have very less time in the admission department of the hospital. As soon as he comes, we have to do the first aid and everything, because patient was brought by his friend to the hospital, yeah, from the trauma side, or maybe some roadsider brought the patient to the hospital, yeah. So we don't have, or first aid is given to the patient. So we have some time, yeah, to do some investigation, prepare the patient in a much more better way to do manipulation. So this part, please pay attention. So anamnesis morbi, any questions, doctor? Dr. Anamnesis morbi, any questions? Hello?
No, sir.
Okay. So let's continue. Next, anamnesis vitae. In anamnesis of life, you will write almost everything that you write in proper therapy and surgery thing. Yeah, but please pay attention to some deformation. See, we can see over here, yeah, osteogenesis imperfecta head is a congenital condition. Yeah, where patient has what deformation. Yeah, dysplastic growth of bones. Yeah, so please pay attention. Yeah, whether there is hereditary, yeah, or some deformation, hereditary oriented deformation in the musculoskeletal system. After this goes to general objective examination and goes to the local status. We finish compliance case. I mentioned this part. So please think about what happened. Congenital condition, yeah, especially related to your musculoskeletal system. If present, please write. Next, general condition of the patient, yeah, so you'll be writing it as you follow in other departments. There is nothing new, yeah. And then comes to local status. Yeah, in the local status, we talk about what happened. We talk about musculoskeletal system. So same like in other field, yeah, everything starts with inspection, then palpation, yeah, percussion is also present, it's excluded, yeah, then auscultation, yeah. After that what happened? Your investigation, yeah, investigation starting from blood, biochemical, urine, yeah, goes to already other instrumental method of examination. Mandatory in our condition is what? X-ray, radiological investigation. And if present, what happened? Other special investigation that we know, we can do CT scan, MRI scan, Doppler, duplex scan to exclude vascular injuries. Next thing that we can see here is what happened, what to do in inspection. Please, when you inspect, yeah, see appearance of patient, yeah, look at the position of the patient. Yeah, we talk about position. Patient can be active, passive, or forced posture. Look at what happened, status of deformation, inspect the region of lesion. Yeah, you should inspect the region of lesion. So what we can see, maybe it is normal, maybe there is swelling. Yeah, swelling can be localized in one place. Yeah, or it can be what happened, it is generalized swelling. Yeah, so we should differentiate the variation of swelling. Yeah, maybe there is a bruise present in the region, maybe muscle wasting present. Yeah, maybe patient has what deformation in the posture. Yeah. So if present any wound, if for an example wound present, the localization, try to explain the wound, how you know from surgery. Yeah, type of wound, is it a cut wound, lacerating, abrasion type of wound, bite wound, yeah, penetrating wound. Yeah, so you try to explain the wound. Yeah, how deep it is, the length and width of the wound, associated injury present in that wound. Yeah, so you'll explain it. So this thing is by inspection. Next we go to palpation. Yeah, so the very important maneuver. Yeah, palpation helps you to localize. If got heat present, yeah, it will help you to localize pain. Yeah, characterize the pain. Yeah, and to differentiate sensory or motor loss or not. Yeah, we can differentiate also. So here, given some examples of posture, yeah. So we can see, yeah, this person Spencer, yeah, he's in the active posture, yeah. Passive posture. What is passive? Here we can see an example of wrist drop when patient has what? Injury to radial nerve. Yeah, patient cannot extend the patient cannot extend. Patient cannot what? Extend the limb. Limb cannot become like this. Yeah, so wrist drop because what happened? Radial nerve innervates extensors of your hand, and what happened here? Damage, so patient cannot do. Here patient has fracture of neck of the femur, so because of that, what happened? The foot is externally rotated. Normally when you lie down, what happened? Your toes, when you imagine, I'm trying to draw, when you lie down, yeah, what happened? Your toes all point towards the roof, yeah, of the building, yeah. But here, what happened? You see the patient toe turned outside, externally rotated, yeah. Why? Because what happened? Fracture of neck of the femur, yeah. Next thing that we can see over here, over here is forced posture, yeah. What is forced posture? Yeah. So for an example, here a patient has what happened? Pain syndrome. Yeah. So the pain syndrome, because of the pain syndrome, yeah, patient is holding. Yeah. Maybe you have what? Like question mark sign. Yeah. When you have acute abdominal syndrome. Yeah. For an example here, maybe a patient has one limb shorter than the other limb. So because of that, what happened? You see forced shortening of the limb. So pelvic is tilted. Yeah. So these are all called as what? Forced posture. There is no other way. Only in this posture, what happened? Patient pain syndrome or some condition can be relieved. So that is called forced posture. Let's continue in inspection. Yeah, inspection something. Yeah, inspection some point that we left. So inspection also makes us to think how is the limb. So limb is in normal axis, or patient has, for an example here, the angle open outside. It is called valgus. So we can see over here valgus, VAL. Yeah, or patient angle opening inside. Patient has what? Varus. Or varus angulation. So here we can see a varus limb, yeah, angle opening inside. Here angle is opening outside. Here we have a valgus limb. Yeah, so varus, valgus. So normally what happens? It should be like this. So how to do this thing? So for upper limb, so simple. Yeah, we have points. So we find acromion. And we actually take a measuring tape or any thread here, draw a line from acromion to the styloid process, the radius, that this line should go through the head of the radius or cubital fossa. If it is going, it is normal. Here it is no. When we talk about the lower limb axis, so we draw a line from anterior superiliac spine in between the base of the first and the second toe. The line actually go through the lateral border of the patella. But here it is not going completely. Here it is opening inside. This only we call as varus angulation. Here it is going outside, so we call it as valgus angulation. Any question on varus, valgus angulations? Doctors, any questions on varus or valgus angulation, doctors? Hello? Hello?
No, sir.
No questions.
Yes, sir.
So palpation, yeah, you can determine the temperature, localize the pain, humidity, disorders of sensitivity. You can talk about the skin tone, yeah, and also condition of the muscle, yeah. Here, apart from that, there are some special signs that you'll be paying attention towards it when you study. So we have line and triangle Gunter. When your elbow joint is extended, there is 3 points: medial epicondyle, lateral epicondyle, and also your olecranon process. All these 3 things will lie on a straight line. When you flex your elbow to 90 degrees, these 3 points will form a triangle. Medial epicondyle, lateral epicondyle, olecranon process, they form a triangle. So this is normal. If you have dislocation of elbow joint, yeah, when you have dislocation of elbow joint, there won't be any triangle or line. Next thing, in the hip joint, yeah, we draw a line when the hip is flexed 145 degree. Yeah, draw a line from anterior spine to ischial tuberosity. Yeah, this line will go through your greater trochanter. This is normal. If you have dislocation in the hip joint, once again, this rosolateral line is going to be damaged. Next thing, auscultation. Yeah, so auscultation, you can examine your lungs, not just the lungs. We can put it in the joint. Yeah, we can hear clicks, especially in case of meniscal injury. You can even put the stethoscope in the zone of fracture and try to move the joint, and we can try to auscultate what happens crepitation. So auscultation is a part and parcel of our thing also. Next thing, that is new. Is what happened? Examination of what? Function of the musculoskeletal system. Yeah, so that is what happened. We have to examine volume of movement in the joint. We have to find muscle strength, and so here how to find range of movement. So range of movement can be did using what happened? A device called as goniometer that is being shown over here. But if you don't have goniometer, you can go to Apple Store or Google Play and download an app called as goniometer. You can download this app, put it on your phone. Yeah. Instead of putting this goniometer, you put your phone concretely on this limb and try to move the limb. Automatically, your phone, you can on your phone screen, you will see how many degrees the patient can move. So here we can see movements like patient can, the shoulder joint can do what? Abduction. Yeah. And then what happened after the patient can do adduction, he'll bring back. Yeah. So let's try to draw. So patient is doing. He can go do abduction. In the same way, what happened? Patient will bring back. In the same way, patient can do flexion, and patient can do what? Come back, extension in the shoulder joint. Yeah. So and also in the shoulder joint, patient can do internal rotation and external rotation. Yeah. So when you come to our department, yeah, so please ask the teacher, yeah, to explain you. So teacher will explain you also how to use how to do this test. Yeah. So here we have a table for you for reference. What are all the normal range of movements? So if you take shoulder joint, we can do flexion, extension, abduction, adduction. Yeah. So these movements, what is the normal range? It is explained over here. Elbow joint, we can do only flexion and extension. Plus what happened, we can do what? Supination, pronation, that is internal rotation, external rotation. So these normal values are given over here. See, you'll go through this normal value and during your practical classes, please pay attention. Ask the teacher to explain, yeah, if you have doubts. Understood, doctors? Hello, please don't skip this thing. This is very important. Understand, doctor? So how to do this thing? I try to manage to write this thing. Yeah. So here we have, see, let's take our elbow joint, wrist joint. So we have flexion. This is neutral position. And then we have extension of the elbow joint. So when we talk about flexion, patient flexed approximately 90 degrees. Yeah. So we wrote here, neutral position is 0 degree. And how many degrees patient extend? Yeah, approximately 135 degrees. So we write, this technique is called what up a neutral. So neutral position method. Yeah. So when we do this thing, we write actively. That means what happened? Independently patient does how much, and then what happened? Doctor passively is what happened? Doctor will move the joint and he will write it. So there should be always these two readings in any affected joint. Understand, doctors? I hope this picture explains you. Yeah. Hello.
You mean to say we have to write both active and passive movement?
Yes. In the normal side, in the healthy limb, it is going to be the same, but in the affected limb, it is going to differ. Understand, doctor? Values can differ. Yes. Okay. So we can see once again in the foot, yeah, how it is. Yeah, plantar flexion. Yeah, how many degrees? Yeah. Then neutral position. Then what happened? Dorsiflexion. How many degrees? You'll be writing it. So here there is a chart. Chart is available. Yeah, this chart is available for you to refer normal values. For other movements, please ask your teacher during the practical skills, because we are online. Yeah, I can't demonstrate this thing on some of you. Yeah, but this thing can be easily learned. There is nothing hard into it. Why we check range of movement? Why do we do this thing? Because what happened? We can come to some conclusion. What conclusions we can come across? So some patient will have complete absence of movement in the joint. In that case, we write the diagnosis ankylosis. That means what happened? The joint is fused. His limb is like a stick. We can't bend. We can't do any movement. Next is rigidity. What happened? There is movement present. Only 5 degree patient can flex or extend. That time we use the condition called rigidity. Next is contracture. That means what happened? If patient has to, if let's go back to this limb, yeah, in this limb patient can flex until here, yeah, but only flexion, patient is flexing only until this point. Yeah. As the patient extend, instead of extending like this, patient is only extending like this. We call this condition as what? Contracture. So limitation of what? Range of movement. Limitation of range of movement. Yeah, that condition we called as contraction. Next condition is called as what? Superfluous movement. What is superfluous movement? Is increase range of movement in a normal axis. This is called superfluous movement. Please write it in bracket called as Bayes' scoring system. Bayes scoring system. We will try to see, remind me in the next lecture, I will try to show you, yeah, when the camera is replaced, we'll try to show you, yeah, and we will try to see what is. So what happened, when you ask the patient to flex, he can flex more. When you ask the patient to extend, patient can extend more, yeah. In this normal axis, patient is having increased range of movement. This is a physiological condition. This is physiological condition. Next is pathological mobility, movement in abnormal anatomical axis. You take your elbow joint. In the elbow joint, we can't do abduction or adduction. If patient can make it, this is pathological mobility. In the knee joint, we can't do abduction or adduction. So if this movement is present, we call this condition as pathological mobility. So we should make this conclusion after you measure the range of movements. Next thing we should also do is what happened. We should measure the length of the limb. Yeah, so after you measure the length of the limb, we can come to some conclusions. Patient has normal length. Patient can have anatomical shortening. This will happen in case of fracture. Patient will have relative shortening. This will happen in case of dislocation or seemingly shortening. It is common when patient has contracture. Just now we discussed a condition called as contracture. Yeah, in that maybe patient will have seemingly shortening. Yeah. So how to measure length of upper limb? Once again from acromion. Yeah, if they ask you to measure with the hand, then you go to the middle finger tip. If it is not acromion, to the styloid process of radius. Next, for individual bone length, you fix the elbow joint this position from acromion to olecranon process. This is length of arm. Forearm length from olecranon process to the styloid process of the ulnar bone. Yeah. This will be called as what happened? Length of the forearm. Understood, doctors? Hello? Understood? Length of the upper limb. Lower limb, we have two origins. One length can start from anterior superior iliac spine. Another length can start from greater trochanter. When you start from anterior superior iliac spine, it is called relative length. When you start from greater trochanter, it is called absolute length. So it will go, you can measure it until what happened? Medial malleolus, or you can go, this whole length can go until what happened? Lateral malleolus. Anything is same. But if you measure in one limb from the origining point, we should measure, if you measured in one limb, lateral malleolus, the other limb also should measure only to lateral malleolus, not to medial malleolus. So this is whole length. Individual length. Length of the thigh, once again, two origin. It can be from anterior superior iliac spine or greater trochanter, the same names. It will get until what happened? Interarticulating space in the knee joint. Next, length of the leg is going to start from interarticulating space in the knee joint until lateral malleolus. So you measure and write them in centimeters and try to see, is it equal or there is shortening? If there is shortening, so I told you already few reasons. Yeah. True shortening. What will happen in the true shortening? Imagine this patient has fracture in the fracture in the thigh region. So what will happen to the whole length? What do you think, doctor, when compared to this healthy limb? What do you think? What do you think, doctor? If patient had a fracture in the thigh region, what will happen to the whole length? It is going to what? Decrease, yes or no?
Yes, it's going to decrease.
Okay. So what will happen to the individual bone length in the thigh region? Individual bone length in the thigh region. It is also going to decrease, yes? But what will happen to the leg length? It is going to be normal, yes? Hello?
Yes.
So what will happen? You see, you measure the whole length. When you compare it to this length, it is shortened. And you try to measure individual bone length. Only what happened, the thigh region, the length is shortened. The leg region, the length is normal. So of course you will think what happened. Whole length also shortened individually in concretely the thigh region, the bone is shortened. Yeah, of course we talk about the condition called as what happened, anatomical shortening. Yeah, both this two length is decreased. So of course it gives you orientation. What happened? The problem is located in the thigh region. That means femoral bone has fracture. Okay, doctor. What is relative shortening? In the relative shortening, what will happen? Individual bone length, that is whole bone length will be decreased. But when you try to measure from greater trochanter to this region, yeah, let's try to change the color. Right? Where is this one? So let's try to talk about relative shortening. Yeah, let's try to talk about relative shortening. So what will happen to the whole length? So whole length is going to decrease. Whole length is going to decrease. Imagine patient had dislocation of hip joint, yeah. But when I measure length, individual length from greater trochanter to here, it's going to be the same, normal. Length of the leg is going to be normal. So of course, what I will think, see, whole length decreased, but individual bone length is not shortened. Individual bone length is not decreased. Of course, there is no fracture. So what happened? Something happened in the joint only. Yeah. So this is dislocation. Understood, doctors? Understood? Hello? Everybody understood? Seemingly shortening happens because of contracture, which we will be talking also in the next lecture. When the video is good, then we will talk about that condition also. I will stop here. Yeah, I will stop here. I will stop in this point. Yeah, because time is already a lot of time. Yeah. Next lecture is focused on. Next lecture is focused on examination. Yeah, of trauma, like how to treat the trauma and orthopedic patient. Yeah, so we will discuss more in detail the clinics of trauma and orthopedics. Just now, continuation of this lecture. Yeah, and we'll try to do first aid and treatment. I will explain those things in detail in the coming lecture. So coming lecture, everybody should be present. See, I give an assignment to you all now. Please, everybody in the chat, yeah, please write your group number so I know who is present and who is absent. Understood? Hello? Understood, doctors? And group leaders, group leader, you make a note. Yeah, please search your group mates to the right and to the left. Yeah, so we have only 64 students. Yeah, I will fix this point. Yeah, including me, 64. That means there is only 63 students are present. So group leaders today, I don't know how. Let me give you. See, this is my WhatsApp number. Please, I send my WhatsApp number over here. See, batch leader already came to the lecture or not? Esther, I heard. She's present or not?
I'm present, sir.
Very good, Esther. Esther, see, I gave my WhatsApp number. Yeah, you will make a WhatsApp group with all your leaders of your batch. Understand, doctor? And invite me to join that group. Okay.
Okay, sir.
And then in that WhatsApp group, every leader from the groups in your batch, you will tell me who is absent, because in this semester you will be probably having offline classes, and if you're absent for lecture, you'll have -1 in your exam. So please don't be absent for lectures. Please be present for lectures. So first lecture, maybe it will be a little bit gracious. Only 63 students. Now you have 65 students. You're crazy. When somebody told about lecture, 2 students joined the lecture. Yeah. Okay. So please write all the persons. So group leaders, please take screenshot of who is present Understood, doctors? Hello. Group leaders, understood or not?
Yes, sir.
Yes, sir.
I'm sorry, where is your WhatsApp number? I can't find it in the chat.
It's in the chat top. You go to the top part of the chat, you'll find. I also took screenshot, yeah, for cross reference. Who is present for today's lecture? Yeah, group leaders, please work on, yeah, and later give me feedback. Who is absent in this in your group? See, crazy man. One more person also joined. Yeah. So very good. See, now two students joined already. Yeah. Okay. Anyway, that's good. So hope you all had a good time listening to the lecture. Yeah. Have a good evening. Yeah. So once you write your group number, you can be free, doctors. Have a good evening. Take care. God bless you. Bye.
Thank you, sir. Have a nice day.